you very much for the opportunity to testify to strengthen Ohio's Medicaid funding system so that we could prevent fraud. I have testimony written, and I'm going to follow it as much as I can, given that we have 5 minutes. But I want to stress that Medicaid is really meant for vulnerable Ohioans. Every dollar spent that is stolen from people that really need it in the state of Ohio, it's an elderly person, disabled, kids with autism. So it doesn't just merely try and steal tax dollars. It's actually destroying public trust and monies that we need for people in Ohio, our most vulnerable. I'm testifying because I have spent several months investigating as a taxpayer, an attorney, an Ohioan. I also work with the Daily Signal now on Ohio fraud. Whistleblowers back in December came to me and shared that they had gone to several legislators, several offices, and the Attorney General's office because there was massive fraud in the state of Ohio. They specifically asked the Attorney General's office to please not share their names, but they wanted to share all the information because they feared to be stoned to death within that community. They identified the Somalian, Nepalese, and Bhutanese community where this fraud was occurring, and primarily there's a language barrier. Many individuals don't speak English, so they seek out certain providers that have either a common background or can speak multiple languages. They were told that I was told that individuals would sometimes, seeking home health care services, would not only be coached by home health care providers, but in many cases, the applicant was actually accompanied by a home health care provider that would speak for them in terms of ailments. These providers conducted MRIs, CT scans, and then declined to actually allow for approvals because their medical need was not substantiated. Thereafter, these providers were threatened, verbally told that we are going to go back to our old provider that stamped this paperwork for us. And some healthcare services, one of them in particular, actually said, "I'll make it worth your while," which sounds like a kickback. I provided all of this information to the Ohio Department of Medicaid, all of the providers that are potentially engaging in fraud, in addition to even the home health cares that are complicit in this, and asked them to do an investigation. I also went to the Attorney General's office. They specifically first asked for the names of the whistleblowers, which I wouldn't give them, attorney-client privilege. I represent them now, and they cannot protect them. They continued to push, saying that they would subpoena me, and I told them they had all the information needed. But this is the type of cover-up when you're unwilling to actually work with somebody who's providing information, detailed summaries, explaining how the fraud and corruption works. At the Department of Medicaid, I spoke to several people there on a phone call and specifically said, all you have to do in addition to auditing, start with anybody who closes their program starting in December. That will tell you, because they're moving to Pennsylvania. I'm not asking you to track the fraud to Pennsylvania, but if you actually stop and audit just anybody closing, that will show you fraud, because their biggest concern was racism. Well, fraud is not the cost of doing business, and it's certainly not racist to look into allegations and to make sure fraud isn't occurring. During my recent visits in months, we had one home care health center that had 34 providers in there. Many people weren't even present. One or two people that we were able to speak to didn't even speak English. They didn't know how to actually explain what home health care services were. They would call somebody else and they'd tell me to come back. On my fourth visit, 3 men cornered me and stated that that they do not want to provide home health care services to me, which is fine, but continue to intimidate and call this racist when all we're doing is asking basic questions in our state. I have outlined a lot of potential opportunities for us to strengthen, but one of the biggest things the governor's executive order does not do is, if you stop new home health care services, that's great, but what about the ones that are already existing? What about auditing those? And the fact that we haven't done that is shocking to me. There are places where individuals are billing. So an individual could come in and make $75,000 at a home health care provider. You add a parent, you add, let's just say my parents in addition to my husband's parents, now you're making close to $250,000 to $500,000. Those all should be flagged within the system. We also need to inquire independent verified medical necessity. And there's two options here. The General Assembly could actually create doctors that are approved to provide, that are approved to look at home health care services and patients, so that way you have an approved system of doctors that you have verified on a list. They need to apply, they need to be verified, they need to be in good medical standing with the board. Those are opportunities for us to strengthen this. The other way to strengthen this is also to make sure that we have an assessor that's independent, that's not tied to any agency, that's actually verifying the recipient's limited functions, the medical necessity, the hours. Also, we need unannounced site visits. I guarantee you, if people had visited from the Department of Medicaid the number of times I went to these facilities, you would have known that there was something wrong. The Attorney General's office had letters underneath the door, several other mail that just wasn't opened. It's a completely vacant building. There are hundreds of these. In addition, I think we need to also look at shell company patterns. Ohio should implement automated analytics to help with shared addresses, phone numbers, emails, bank accounts, ownership, duplicate overlapping of business registrations. This is something that has occurred over and over again, where you have one person that can own up to 50 to 60 home health care and make millions. My biggest issue right now is the Department of Medicaid, through a public records request, has refused to give us how much we're spending on home health care systems. After 5 months, their response to me, our tax dollars, their response was, please go talk to our vendor. That's unacceptable in the state. You made me wait 5 months to tell me that our tax dollars are sitting at a vendor, and we think that's okay. There needs to be a transparency checkbook for Medicaid. Every single dollar, we don't need patients' names, but every single dollar that we have going out that are our tax dollars, we want that transparency. We want that audit for everybody. It doesn't matter who the home health care service is. And lastly, I'll just tell you, whistleblowers need protection. They shouldn't have to come to attorneys like me. And yes, I did this pro bono because I believe them, and I believe this work warranted a lot more from Ohioans and a lot more from our leaders. We need whistleblower protections. And if you look at the crime, I know that we are strengthening the penalties. Under current law, Medicaid fraud is involved. Less than $1,000, it's treated as a misdemeanor. I know you're looking at penalties, but I support the idea of also using Medicaid fraud as a predicate offense under the Ohio's engaging in a pattern of corrupt activity. That way you have another way that we can bring law enforcement and the U.S. Attorney's Office in terms of enforcing our law. I think it's weak right now, and that's another area for strength. I'm happy to answer any questions. Thank you for the opportunity to testify.
Thank you so much for your time today, Ms. Cooke. Representative Romer.
Thank you.
I'm happy to answer any questions. Thank you for the opportunity to testify.
Thank you so much for your time today, Ms. Cooke. Representative Romer.
Thank you so much. I appreciate you being here. One of the things that I've looked at is the number of patients that are approved by doctors. Do you think that it would be effective if we had some sort of tracking mechanism that would say these doctors approved something at 500 or 1,000% of the average versus these doctors who might do 1 or 2 approvals for home health care patients on a yearly basis?
Representative Gross. So Representative Romer, that's an amazing question, and I think that's where the data analytics are important, that we're not just auditing the home health care services, the individuals that are trying to get certified, that needs to be strengthened as well, but also having a tracking system. So whether you have an Ohio-approved list of doctors or you have doctors that have to submit how many individuals they are approving, that's a guaranteed way to know that there's some doctors that are approving, let's just say, as you said, 500% versus some that are only approving 10%.
Thank you. No follow-up.
No. Representative Timms.
Thank you, Chair, and thank you for being here today and for your testimony. I have a question about the complaints that you received before you represented the client. Did you reach out to the Attorney General's office? And if so, did you ask your...
I can hear you.
Okay. Houston, we have landed. So I asked this question because the last time we had a hearing, the Medicaid fraud unit section came and they talked to us about how many cases they had open and how they were working at this, and that these units exist in every single state under federal statute. And you are saying that you reached out to the Attorney General's office and nothing was done and nobody called you back, or they just wanted the person's information?
I am saying that the whistleblowers reached out to several offices, including the Attorney General's office. They asked for anonymity, and they were not granted that. They then came to me, asked if I would represent them because they did not want to go on record with any of these offices because they do not want to be, it's a cultural thing. They say stoned to death, but they don't want to lose their lives or their livelihoods. So when that information was shared with me, I shared it with the Department of Medicaid, the Attorney General's office, and then I also followed up with Keith Auditor, who's our Ohio auditor. The Attorney General's office was notified about these complaints over almost a year ago. When I notified them in December, it's because things started heating up in the media, and that's the only reason they called me. And then they wanted the whistleblowers' names, and I refused that, I think, based on attorney-client privilege, and also I'm giving them the list of everything they would need to investigate. Did I answer your question, Representative Timms?
Follow up?
Yes, please. Thank you, Chair. It seems odd based on what you're saying and how typical whistleblower complaints go. I will say that. I will move on to the next question.
What part is odd? To the chair, Representative Gross, may I ask Representative Tim, what part is odd?
I'm asking the questions. So my next question is, you mentioned that you decided to pop up at a site on your own. I'm assuming wearing your journalism hat or your investigator hat, I'm not sure which hat, but you showed up to investigate a home health care agency, so a patient's home. Where did you pop up at? I'm confused. You said that you did like a surprise visit to investigate and you encountered someone who did not speak English. That is what you just said. So I'm asking, where was this? Where did it occur?
Well, you made an incorrect assumption. I would never go to somebody's home, so failed assumption number one. I went to an office building that's a public office that is open to anybody that comes in and seeks services. I knocked on a door, asked for permission to enter, and asked if they provided home health care services. And as I stated in my testimony, the majority of those offices, nobody was present. The couple people I did see, one was a very young woman who said she doesn't know anything about home health cares. May I call my uncle? And I said, that would be great. So she calls her uncle, and the uncle said, can you make an appointment? And I said I was happy to come back, and she couldn't give me any times. I said, I'll come back the next day. Nobody was there. One other home health care, again, this is all, imagine like one office building with tons of offices with locked doors. So there's nobody in there, and it's not somebody's personal home. These are just public buildings that if you wanted to walk in tomorrow and say, hey, I'd love to talk about home health care. One individual did go through a little bit of home health care, and when I asked her why there was nobody else in the building, she said generally she doesn't see a lot of traffic. So I have all of these notes, but for the most part, many of the individuals were not there. The couple people that were either didn't speak English or didn't really understand what home health care services were.
Thank you. I think that was two. Are there any other questions for the committee? Yes, Rep. Lett.
Thank you so much, Chairwoman. I just wanted to follow up a little bit on what Rep. Timms was asking. You know, it's interesting to me that you're showing up to the location in which the business is based out of, but home health care, and I know because my son has disabilities and we receive DSP services and home health services to help us so that he can live in the home. Those home health care providers are not at the office. They are dispatched throughout the community all day long. So I just want to, state that for the record. I would love for you to opine on that, but I don't think it's a reasonable expectation that the entire office is fully staffed and those folks are in the home office. That is not the purpose of home health, and that would be more concerning to me than if, they were out and about in the community. So would love your thoughts on that, please, and thank you.
Representative Gross, Representative Blatt, thank you for the question. And I'm glad your son is receiving care. Generally, I'm not expecting a full office, but there's usually one or two people there. I have a friend who has since sold his home health care. I mean, it's a functioning office with admin that are taking in calls because somebody didn't show up. My grandmother is in her 90s, and she also receives, for a few hours a day, home health care services. So even that home health care has an administrator or somebody to say, oh, the home health care aide didn't come, let me help you, let me transfer somebody else. But there's always a couple organizers. If there was one person, well, that's, in my mind, sufficient. But there was nobody. It was a complete ghost town. And the couple people that were manning the office really didn't understand home health care systems. And the other thing that I found really interesting was every door had a sign. Most of them said they were open 8 to 3, 8 to 5, but they weren't open. So that was the other part that was confusing. I did call a couple, and generally it was a man on the other side, and it wasn't, hi, this is home health care kindness. It was, hello, who's this? What do you want? And I'm like, maybe I'll just go knock on the door and see if they're willing to answer my questions. Face-to-face goes a long way versus text messages and phone calls with people.
Follow up?
So, but you are saying that there were 1 to 2 people there when you went. I see what you're getting at. I understand that it's concerning, but
I'm sorry, they were empty offices. There were like 1 to 2, and like let's just say there was one home. So it's 34 home health cares. One office may have had one person. The third floor may have had one. That's what I mean. But they're all separate home health cares.
Through the chair to the witness. So what you're saying is there's 34 individual provider companies,
yes,
not offices where one home health provider is, setting up their desk. Is that correct?
Yeah, correct.
I just want to make sure that we are understanding what we're talking
Yeah.
about here so that it's correct for the record. Thank you for clarifying.
Thank you.
Thank you. Representative Hall.
Thank you, Chair. Through the chair to the witness, my apologies for coming in late, first off, so I didn't catch everything. I was trying to read as you were going through. But first, let me just say that, I work in healthcare in my day job, right? So I find fraud, waste, abuse, abhorrent in all its forms. So again, appreciate the things that you've come to talk about today. My question was going to be, there's sort of the bucket, and we talked about, I think, last committee meeting around Mfuku. I can never say it right. But the unit that does the investigating from the AG's office. And I asked them in committee, I said, do you have enough in the way of resources? And, the answer was like, yeah, we have 900 cases, but I don't want to say no to more resources, but I think we all know what he was trying to say, I need more resource. That's just one bucket. So my question, though, is you mentioned the site visits, and, I think last count, there's over 850 home health agencies in Ohio. I think it's closer to 1,000 now. I'm all for site visits. If I had my druthers, they all would have a site visit unannounced multiple times a year. My concern, though, and this is my question for you, is it doesn't appear, though, that either ODM or ODH are appropriately staffed to be able to carry out that level and that number of inspections. We all talk about fraud, waste, and abuse, and how it's just a deplorable thing. But if we're not going to fund additional resources to root it out, fund. I don't just mean saying let's require ODH to do 1,000 visits without giving them more manpower and more funding. Sorry, woman power too, by the way. Just what are your thoughts on the resource allocation to actually rooting out fraud, waste, and abuse? Do you have any suggestions or thoughts on that?
Representative Gross to Representative Hall. Thank you for the question. So I think that there's 2 buckets here, and you're right. The AG's office definitely needs more help and more fraud-based investigators for home health care to you name the fraud. If there's a welfare program, we're going to have fraud. There's always going to be a level of activity that people engage in. So I do think more resources there and priority. But I think we have to start with the basics. Look at the application for home health care services. Only 6 states allow for a relative to do that. Only 6 states, Ohio, and of course, you guys know Minnesota. So we have to start thinking about maybe it shouldn't be our own family members and take that into account. Look, I just shared with you, my grandmother has a home health care service aide that comes in. My mother could have easily applied She's very qualified, but that really shouldn't be the funding that we're providing family members. Our family members are here for love and support. They really shouldn't be the ones that are caregivers that are then dipping into funds for somebody like Representative Lett's child. I think that's unacceptable. So let's look at that. Let's review it. We're one of 6 states. So I say that again. In terms of rooting out the fraud, though, our home health care application, I mean, anybody can apply. I'm sorry, but these are, the bar is so low. And then we expanded services during COVID, and we never pulled those back to really rethink, what is home health care really for? What is that purpose? And then the other part of this is the only way that we're going to detect it is to be smart by it. We have lots of people working at Medicaid. They need to start detecting at a certain level, let's do an audit. They're not doing that right now. Representative Hall, they don't even know how much they're spending home health care systems because after over 5 months, they asked me to go to their private vendor on how much money we're spending. So if we were to call Medicaid right now, and I was to say, do you know which vendors have spent $2 million or $5 million? They would have to say, can I put you on a hold for 5 months? Let me go ask my subcontractor. That's deplorable. We should be able to actually have a system where you can get on, your family members can see who's getting the most Medicaid funding. I mean, that's how you detect fraud when there's spikes. This is common sense. You don't even need a law degree or anything else. So I think some of it also is creating a blueprint, which I have reached out to the White House task force to ask for one, to work with them, to provide to this committee. There should be a blueprint of internal protocols that we have where we're not just throwing more money at controlling board and saying, well, I need more money for fraud detection. Some of this is just user common sense. Gosh, this provider is spending millions.
Follow-up?
Oh, yeah. Thank you, Chair. Through the chair to the witness. Okay. I said one more follow-up question, which was, listen, there was a famous nurse that once said that sunlight is the best disinfectant, right? With regard to transparency, do you think that there's a role in AI to basically, sort of go through? Because I mean, the data is. It's a ton of data, right? And so, what are your thoughts around the use of AI to look for patterns in data with regard to detecting fraud, for example?
I'm 100%, Representative Hall, I'm 100% supportive of this because AI can detect the higher levels of spending, but then you still need a physical person. There's no replacement for you or me or anybody else on this committee to go to a home health care and say, my gosh, they haven't been open in a month. There's nobody there even taking the phone calls. It goes to some random man who says, what do you need? So AI could be instrumental in this. And there's ways that we can reduce costs without using manpower for every single thing. AI could also be used for what Representative Romer had brought up earlier about doctors. Doctors should be reporting to Medicaid how much they're billing and how many patients are receiving home health care. We could use AI to look at the top 25 doctors and just do periodic audits there if we don't have enough manpower. And while we're talking about this, look at the nurses as well. There's several nurses, and I have a list of them that I'm happy to send to the new Attorney General when he gets into office, but there are a list of nurses that are also, I'm told, allegedly rubber stamping lots of this. So maybe rethink who should be providing and approving home health care. Let's just maybe consider doctors and not nurses. Thank you for the question.
Committee, are there any other questions? Thank you, Ms. Cooke, so much. I would like to ask you one question, and I don't mean to put you on the spot here. Do you happen to remember, I'm certain there must be places we could all in our spare time go and visit the places you visited. Do you happen to remember a street or an office building that we could just walk into ourselves and go see for ourselves?
Yes, so I have an address in here. It's 2700 East Dublin Granville Road. The nice thing is there's also a bank there if you need to do banking, but you could easily stroll in there. There are 34 empty individual home health care centers couple people half-staffed in the past, and then also trucking companies with nobody in there.
And I believe, if I'm not mistaken, that was the same building that billed almost $66 million to Ohio Medicaid.
Yes, and this was flagged in December to office holders. I think it's a national embarrassment for me to have to go on live television and talk about our state like this when you have Daily Wire coming in to actually talk about what we could have done together as a state, as a group of individuals to correct this.
Thank you so much. Committee? Thank you so much, Ms. Cooke, for your testimony
you.
today. We really appreciate you.
Thank you so much.
Thank you.